We got a call last week. Daughter's in New York, mom is in Florida. Daughter cannot get a hold of anyone. What do? We have a special guest that's going to tell us all about it. Stick around.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good morning, good afternoon, and good evening. I guess that's my thing. I don't know where any of you are, but that's why I say that. Hello, my co-host, Lucy Torres.
Hi, how are you today?
I'm wonderful. We have a wonderful special guest today. Her name is Hope Garling. I know Hope for about 20 years. She is with Unicity Care Management Services, and she is going to share all about crisis in family. Hope, good morning, good afternoon, good evening.
Good morning, good afternoon, good evening to everyone out there. Thank you so much for having me, Andrea and Lucy. Great to see you.
Oh, it is
again.
our pleasure.
So, Hope, I want to talk about the phone call that we get probably about 3 or 4 times a week, where family leaves out of town. And all of a sudden, mom is in a hospital. They can't get a hold of the doctors, the case managers, and they don't know what to do. They have their own families, and they can't just fly over here, at the same time. And so we usually get those phone calls. And we have been working with you for the last 20 years, and which is you are an amazing, incredible care manager, and you are a senior advocate, and you do a fantastic job, and your love and dedication for the seniors is amazing. So we would like for you to share with the listeners what care management really is.
Absolutely. And again, it's so great to be here. And, care management just really comprises so many different things. But I think the best way really to approach this is to specifically talk about the example that you just gave, which is really a good use of our talents and expertise. We are master's level social workers and nurses with many decades of experience. And a lot of what we do is education and support, but a lot of advocacy. If you unfortunately have yourself or have had a loved one, anything related to the healthcare system in the last 20 years, you've seen some major differences. And you just touched on it. It's really hard to get people to call you back. It's hard to really know what's going on. Even if you're an alert and oriented senior, it can be really difficult to really stand up for yourself. You're there because you don't feel well. You're there because you're injured. You're under the weather. I've seen many instances throughout my career, doctors come in and out, don't even introduce themselves. And then, the person goes home and they're like, true. I don't know, who is this person that billed me $800? You really have to have an expert who knows how the system works, what questions to ask, and things of that nature. There's also the medical aspect, knowing different conditions, different disease processes, what to expect, what medications maybe could be altered a little bit, what medications literally can cancel each other out. And also, there's not a sense of urgency, I think, that there used to be. I don't know that people don't care. I think a lot of them are really overwhelmed. So especially in the hospital, a lot of what we do is bridging that communication gap, right? And knowing what questions to ask, what information to get. We don't want people discharged too quickly. We want to make sure that they are getting the proper care, treatment, tests, but also medications. I've even seen cases where from the emergency room, we've given in written form someone's allergies, and oh my goodness, it's been missed. That can be a life-threatening situation. But there's also preferences, and so it's just really, it's not standing on top of the healthcare providers, the doctors, the nurses, the physical therapists, criticizing them. It's working with them in collaboration and showing them we're there to support them and help them, and really to make their jobs easier as well.
Right. One of the things that happens a lot, in our business, as you well know, we had actually a client that was in a hospital, and I was the one who happened to go visit that client. And when I walked into his room, he was naked with only his gown covering his private parts. and the oxygen is almost falling off his nose. Immediately got the nurse and fixed the situation. But I also call my agency, Horizon Care Services, to be able to get a caregiver to sit by the bedside and make sure that that patient was taken care of with dignity. And I know that this is one of the things that you guys coordinate as well.
It is completely. And you just brought up an amazing point, Andrea, and I'm so glad you touched on this. Sometimes people confuse care managers with home care workers. And they say, well, aren't you the same thing? And we're absolutely not. So we have been blessed to work so closely with you and your amazing management team and your phenomenal staff through the years. And I can tell people hands down, there truly is a difference between your agency and your caregivers and those of other companies. And it's just a total collaboration. And while you might even have caregivers in the home with clients who are phenomenal, they might not necessarily have the level of education, quite honestly, or medical knowledge that we have, but we really depend on them, right? So if we go to a doctor's appointment or even in the hospital, I can't physically be there as a care manager all day long. But guess what? Your aide is. So they can tell me who comes in, who comes out, the conversations with the physicians. What did the case manager say? Because I'm sure you know how difficult it is, which you started our podcast, how difficult it is to get a case manager or anyone else at the hospital on the phone.
Oh, absolutely.
So it's such a beautiful, actually, I'm going to call it a marriage between what your amazing caregivers do and what we do, because both of those roles are so crucial to navigating this complex healthcare system, especially for our seniors.
Absolutely. And Lucy, I know that you also had a lot of your own experience.
There are perfect scenarios when the family is frustrated because their parent will not listen to them. And they want to continue to have their control. It's also a dignity thing. And the children come to me and say, I don't know what I'm supposed to do. They're not listening to me. And who do I refer them to that they will listen to? That's a perfect opportunity to bring in a care manager, because
Exactly.
a care manager, they have the credentials, they have the experience, they have the knowledge. And this will allow the family to kind of step back, though they're still part of that circle of care. They know what's going on, but they're able to pass the ball over to you. And now you can have, the ball in your court. And 99% of the time, the patients felt like, this is a trusted individual. They're knowledgeable. I have my own care manager. And they will speak to you before they will speak to the children.
Absolutely.
And this is about everything. We're talking about not just their personal care, but their finances and even their last wishes. I found that to be true, that they develop such a bond with a care manager. And it's exactly what it says, care manager. You're managing their care overall in their life. And you really bring them hope, like your name.
Yes.
Just like your name, you bring them that hope that they feel like, I'm still in charge. I still have my independence. I'm making my own decisions. And they can do that with you. And that's what I found in that experience. I would tell the children, I see this scenario all the time. You have to understand that though, yes, in life, the tables turn, is the circle of life where they took care of us our entire life. Now we're trying to take care of them. In their mind, just like in our minds as parents, we are the parent. You're not going to tell me what to do. I'm going to tell you what to do. You don't know more than me. Doesn't matter how much education your child has. You don't know more than me. So bringing in a professional with your experience gives them more of that comfort, and it allows them to kind of bond with someone and allows them to still have control, when in reality, you are having the appropriate control with their children to protect their parent. And I found that to work with any situation that I experienced in that way, and it was so helpful. It really was.
You brought up some awesome points, Lucy. And I just want to say, part of this is you always have that parent-child relationship, right? It's still there. And it doesn't really matter if it was a great childhood, if it's a healthy relationship, or if there have been some pretty serious bumps in the road.
Dynamics.
It's difficult. And there's a little bit of role reversal anyway that goes on. And so what we find too is we're able to help those families maintain the integrity and the love and the beauty and the joy of that relationship.
Absolutely. And to navigate everything.
Exactly. And I even have clients where the adult children live locally, But they've actually said, Hope, these are great ideas. Take mom to the Murakami Museum, take mom to the Jupiter Lighthouse, whatever it might be. Let me do the fun things. You take care of the medical stuff.
Okay.
And I love that. And that gives
great.
you that balance.
And you mentioned that a lot of times people don't understand the difference between what you do as a care manager as to home health services, because we incorporate everything together. But if you can kind of explain, like, you being the care management company or care manager doesn't take away from Horizon still being in there. We can collaborate, work together to even bring more services to this person.
So the other thing that happens too is when mom or dad is starting to get dementia. Any symptoms of cognitive, disorder and all that. And what happens a lot of times is you have one child who understands, one child who gets it, one child who's trying to make the right decision for mom and dad. Then you have 4 other siblings that is in completely denial, right? Dynamics. So it creates a conflict with that family. And the only way for you to be able to break that conflict is to be able to hire a care manager, to be able to come in and explain to the family, as an outside person, being a care manager, like you said before, Lucy, is, they're not, take the emotions out. Because a care manager takes the emotions of the family out of the equation.
Absolutely,
right? Where
yes.
you are able to dedicate that time and that service to do what's the best for the client. Because everybody's bickering. Everybody is fighting with each other. Is either over money, over health, over denial, or whatever the case may be, whatever dynamic it is. A care manager is that buffer.
A peaceful mediator.
Peaceful mediator.
Also for the children, not just the client. You will find that you end up sometimes spending a lot of the time talking to the family members.
Exactly.
And helping bring some peace there. I've seen cases where siblings, they didn't speak anymore, like you mentioned, dynamics. And because of this synergy, now they have a relationship again, because it's all in the best interest of the loved one, of the parent. And it's beautiful story at the end. And you find the families, time passes. I'm sure you've had clients for years, right? And I'm sure you have received feedback of, Hope, if you weren't involved during this time, it's a testimony to the services you provide and what we do to help seniors.
Right. And, you brought up some good points here, and I want to speak to a few of them if I could. So a lot of people do ask, what's the difference? So your caregivers, they provide hands-on care. It can be help with things we call activities of daily living, bathing, dressing, eating, toileting, walking. I don't do that. Okay. Even those of us on the team that are nurses, we don't do that. We can do that if we need to, but it's not why we're there. We're there to kind of have the big picture, if you will. We're there to put the pieces together. And yes, a lot of what we do is mediation, but a lot of times you have those successful reunification of families from education, because look, we all deal with illness differently. We all, even if 5 children were raised the same way, right? They all have different personalities. They all have different perspectives on what their childhoods were like and what's going on with mom or dad.
That's so
and
true.
So we help provide the same information to all of them, but we also meet people where they are. And so, yes, I do have clients that, have been with caregivers for many years, and you do become like family. And so part of what we're doing is also we're counselors, we're mediators, we're researchers. We have to work with all different types of personalities and remain professional. But at the end of the day, we are there for the client. And keep in mind, the client's not just the person receiving care.
That's right.
The client is also the caregivers. The client is also the family. The client is the physicians. So we have to put all these pieces together, try to get everyone to like us, or at least work with us and respect us, and make things as great as possible for the patient.
We have patients that goes in a hospital, and, we need to be able to be the advocate for that patient, because you got to remember, you have hospitalists. A lot of doctors today, they don't go to the hospitals anymore, right? So you rely on hospitalists that doesn't pick up the phone, doesn't call the family, and nobody knows what's going on. So it is so important to really have an advocate.
We have to remember emotions come into play. And though we want to always practice emotional intelligence, but it's easier said than done when it's your own loved one. So a lot of times the way that we react and respond to situations is from first our emotions. So what happens when you bring in a professional, it's not that they don't care, they have empathy, they have compassion, but emotions has to be put to the side to do what's in the best interest for everyone involved on this case. And that's what, as family members, sometimes we fail to remember because we start going into feeling the guilt, frustration, anger. As you mentioned, the siblings, there's a lot of dynamics. I've seen siblings that are arguing, they disagree, they haven't spoken in years. And now this is all based on the emotions of, well, mom or dad loved me more. And where were you for the past 5 years? I was the one taking care of mom or dad. Now you want to come into the picture? I've seen a lot of that, but those emotions are there, and that that will interfere with the care that's needed at that time. So having someone step in kind of helps alleviate that as well.
And what I encounter a lot, Hope, in my business, and you please tell me that you share the same experience, is we have elderly people now having children that they are taking care of. Either they're Down syndrome, either they're handicapped for some reason. And all of a sudden, it's usually the women who are found with those handicapped children. And now they are deteriorating. And what's the plan that we made for that child? And I know that being a care manager, sometimes those plans has not been done. And I know that you work with a lot of local attorneys to make sure that you get that plan done. Again, that's part of care management. There's just so much more to it. So
exactly, and it's interesting that you brought that up because we have just rebranded, and that's part of why we rebranded, because we were finding such a demand for younger adults, many of whom have some type of physical or cognitive challenge, and their parent caregiver or grandparent caregiver is aging. And so they're not able to do all the things for that person they used to do. So we are finding more and more younger clients, which some of the needs and some of the care is the same, but some of it is quite a bit different. And so that's why we said, okay, we need to change and let folks know that there are needs of clients out there that are younger than 55 or 60. And so we've shifted our focus. So we help a variety of different types of adults in situations.
That's wonderful.
That's great to know. And most of the time, the parents have to work.
Yes. And this is another problem, is that even if the caregiver is local, even if they have the knowledge, which honestly, a lot of them don't, there's a lot to it, as Andrea and I have gained, through a School of Hard Knocks and some educational courses as well. The medical field is continuing to change. You have to understand how the pieces fit together. Even if you have all that, oh my goodness, it's stressful and time consuming. And so we take that off the shoulders of the families.
Hope, so what are the 3 signs that a family might need the care of a care manager? Like what things can they look for, or listening to you may kind of alert them and help them identify what their needs are?
That's a great question, Lucy. I'm really glad you asked that. So one of them is if you follow up with your family member and you ask them how doctor's appointment went and you get very little information, because then either they don't remember or they didn't understand, or gosh, maybe it was not good news and they just don't want to tell you. Another one I would say is a recent substantial change in them, whether it's a weight change, whether it's a memory change, if you see the house isn't as well kept as it used to be. And I think the third one would be look at their medications, right? Most people over the age of 50 are on at least 2 or 3 medications. Keep an eye on those. Look at the bottles when you're there. If they're in pill boxes, do they always seem to have the same ones? Are they even? Do you see like empty spaces in the middle of the week? And what day of the week is it? So you want to make sure that they're taking their medications properly. And that's a control issue. And that's a lot of problems between parents and children, especially because they don't want to relinquish that. They think they can still do it effectively. And in many cases, they can't.
I think the other thing that we hear a lot is I just called my mom and she's acting very bizarre. and she is not making any sense. Can you get a caregiver there to check it out? So what we do is we send a nurse out and a caregiver, of course, to make sure that the client is okay. And then we turn around and give it to you for care management, so you can get the thing situated with the family. So
one question I have personally for myself, how do you know how to have this conversation with your aging parent? Because I know my own parents, they think I'm 5. I can't ask them questions. So how do you start this conversation with your parent, with your loved one, with the family member, that we need to start the process of reaching out to, resources that will help us, like a care manager, home care services, or whether it's transitional care, trying to get them into a community or things of that nature. What is your advice?
Again, with every situation, it's different. And part of what we do is we would meet with them and get to know a little bit about their personality. But a lot of times people are in complete denial about their ability to care for themselves.
That's true.
Safety awareness greatly declines. Even if you're alert and oriented, we still think that we're 30 or 40 and we can run marathons. So sometimes it's a little bit of levity. I'm not 30 or 40 anymore. So sometimes I'll share just some personal anecdotes and try to get them to lighten up and laugh a little bit. Other times, people are more concerned about making a mess and causing stress for their children than their own safety. So part of it, Lucy, is really getting to know that person and what makes them tick and finding their hot buttons. And that's individualized. And you can really only do that through conversation and listening.
That's great to know. And earning their trust.
Yes.
I know for you, when you first come in, they're probably like, who are you? Are you here to put me somewhere?
Mm-hmm.
I'm fine. Leave me alone. I don't need anyone's help.
That's a great point. And the first thing that I say to them, I am here to keep you safe and happy. If you want to stay home, I will do everything possible to keep you here.
That's wonderful.
It is an amazing service. Well, anyone that is listening to the podcast, Senior Care Made Simple, please, if you have any question, any topics that you would like for us to talk about in our future podcast, please email us on seniorcaremadesimplepodcast@gmail.com. All the information in regards to our guests will be down in the show notes. Hope Garling, thank you so much for stopping in today and share your experience with us.
Thanks for having me.
Lucy Torres, thank you so much, my co-host.
Always.
Love spending our week with you. Have a great day, everybody. Until next time.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.